My name is Jill, and this is Hannah. Hannah's going to do all the hard work today and do the exercises. Now, this DVD has been produced to work along with the free back care guide that is available on my website, www.gillianthomasfitness.co.uk. It's suitable for those who have had back problems, and equally for those who are experienced exercisers who just want to take things back for basics. I would suggest that you watch the DVD from start to finish before starting it, and seek any medical advice that you need to from your healthcare professional. And please, if you have any questions regarding the exercise contained in this DVD, please don't hesitate to contact me. Email, phone, info@gillianthomas.co.uk. So let's put some mellow tunes on, grab a mat, a cushion or a towel and get started. Hi, so we're going to start on the mat, on your back, which is called the supine position, and we're going to have our legs in a crook position, which basically just means bent. We're going to start off getting you in a nice relaxed position, because that's brilliant if you've got a back pain, if you could just lie on the floor and relax. So we're going to take, the knees are going to be bent and they're in line with the hips. The ankles are just outside, or you can be underneath your knee. We're all relaxed through the pelvis and the stomach, the shoulder blades are down. And Hannah's got her head on a cushion or a block, or it can be a rolled up towel, whatever you've got handy. And I'm just going to let Hannah completely relax. Just relax. The tension comes out of her fingers, out of her toes. It's as if the sand's coming out of her pockets at the side, coming out from under her arms, and she's just nice and relaxed. Okay? Yep. Okay. The next thing we're going to do is find Hannah's neutral pelvis. So what I'm going to ask Hannah to do is just push her belly button in to the mat. So she's imprinting her back into the mat. And then I'm going to ask her to overarch her back, keeping her buttocks down. So she's going to create an arch here. And I'm going to ask her to do that a few times. So she's just going to rock forward and rock back. So if you imagine there's a clock face here, and this is 6 o'clock and the pubic bone is 12. Now 12 o'clock's coming higher than 6 o'clock. And 6 o'clock's coming higher than 12. I'm just going to ask her to do 2 more, and we're just breathing normally. And then I'm going to ask Hannah to bring 12 o'clock and 6 o'clock level. So we've now got a nice clock face that's pointing up towards the ceiling. She should have just a little bit of an arch here, and I can just get my hand underneath it, but not all the way. Yeah? And are you comfortable? Yeah. Okay. Again, knees stay in line with the hips, shoulders are down and relaxed. When we've done that, we're going to activate your trans abs, which is the bottom layer, the stabilizers. And what I'm going to ask Hannah to do is just place her finger on her hip bone, and then we're going to slide the fingers down until we get to, want a better word, a squidgy bit, just here. I'm going to put my finger on one side, and Hannah's going to do it on the other. So you start on your hip bone, and just take it down, and we're there, yeah? And now, if you want for, not to excuse the pun, if you could just cough. And you should feel some activation underneath your fingers, and that's your trans abs, your TVA connecting, and that's what we want to connect. So keeping your fingers there, I'm just going to ask you to pull your belly button all the way to your spine. We don't move anything, we stay nice and level, we just draw the belly button in until you get that connection on the TVA, on the trans abs. Yeah? And then I'm just going to let you let it go. That's it. And then pull that belly button in again, all the way to your spine until we feel that activation, and then just let it go. Okay. One more time, pull that belly button all the way in, all the way in. Now, we don't need that full contraction in order to have a successful working of the trans abs. We just need her to release. So I'm going to ask you to release it by half. And then you're just going to release it a little bit more. And that should be enough of a contraction. You should be able to maintain that throughout the entire workout. It's as if you've got tummy control knickers on. Now, I know Hannah's never worn them, so it's like she's got a big belt across her tummy, and I need you to hold on to that. Okay? I'm going to ask Hannah to just place her hands on her ribs with her fingertips touching. And we're just going to do some lateral breathing. Now, the breathing is great for stress relief and just relaxing you a little bit more. So your fingers are here, and I'm going to ask you to take a big breath in. And the fingers should separate just a little bit. And then as you breathe out, the fingers come back together. So I'm going to ask you to do that just 3 more times. A big breath in, the fingertips separate, and then as you breathe out, they come back together. Remember, we've still got that connection on the tongue. Breathe in, and breathe out. One more time. Breathe in, and breathe out. And now you should be quite relaxed. I'm going to ask Hannah to place her hands by the side of her on the mat. Reach her fingertips down towards her shoulders. Sorry, down towards her heels. She'll have trouble getting to her shoulders from there. And the shoulder blades should just slide down the back towards her back pockets. She's going to put a little nod on her chin. And then she should be in a nice neutral position. And we're ready to start doing some exercises. Okay, so the first exercise we're going to do are heel slides. And what I'm going to ask Hannah to do in a second is just push her heel away from her body into a nice straight line. And she's going to keep her pelvic in neutral so as the back doesn't arch as she does that. So we're just going to breathe normally at the minute, but we'll add breathing in on a future DVD. So I'm just going to ask her to slide away, and she's going to do 8 on this leg. She's going to keep her hips pointing to the ceiling. She's going to keep the connection through her abs. She's managing to stay nice and still there. She's only got 5 more to do. And we do it nice and slow, keeping the foot on the mat at this stage. Now, if you can only take your leg halfway, that's fine. You just take it as far as you can. If you feel your back start to come off the mat, you've gone too far. Is it one more? Just to check that you're counting. And one more. And then we're going to do the same on the other leg. Ooh, big crack. So we've just got a little bit of a wobble here on the pelvis. We're just going to straighten her out, and off she goes. This is the second one. Keeping the tummy in. Shoulders are nice and relaxed. This is an exercise you quite often get given for rehab after you've had spinal work. It teaches the legs to move independently of the back, and so it's actually the legs doing it without putting any stress on the back. How many? 2 left. Just remember, try and focus here and keep these. That's it. 1 more. Okay. The next exercise we're going to do is called knee raises, but we're just going to start with a foot float first. So this is the start, phase 1, shall we call it. So I'm going to ask Hannah just to hover her foot off the floor. We're going to keep with this foot, and she's going to place it down. She's going to do 4 on this. Now what I want Hannah to do is lift that leg without putting any pressure. So imagine that this foot is on eggshells. We're not pushing through, and we're not bulging. We're still in neutral. Is it 1 more? Yeah, 1 more. Now that is quite difficult actually, and she's going to do 4 on the other. What I don't want her to do is imprint in the mat. I just want her to stay in neutral. Keeping this knee still. So much to think about. 1 more. And now we're going to go into the full knee raise. So she's going to lift up, and she's going to keep with this leg and then take it down. She's going to do 8 of those, please. Now you notice the angle of Hannah's leg is not changing. She's not letting this ankle drop down. Now remember, if that's difficult for you, you keep with the first exercise. I think we've got 4 left. No bulging here, tummy in. No arching through the back. Shoulders are nice and relaxed. And we're just breathing normally. Trust me, she's breathing. Are we there? Yep. So we're going to do the same on the other side. Now you may find that one side is better than the other. And if you need to have a little bit of a shufty and release the back off it all in between the legs, then please do that. Now please remember where your hips are, especially you ladies, because I find it quite common that they think it's here. It's here. Okay, so don't take it too far. Are we counting? Yeah. 2 more. Counting's not my strong point. I have to have at least 3 people doing it for me. 1 more. Okay, and taking it down. And you just do what your body's asking it to do. If it's to have a little shufty, then do that. Okay, the next exercise we're going to do is a combination of the 2 that we've just done. So we're going to do a knee raise with a heel slide. So I'm going to ask Hannah to just lift the knee up above the hip, ankles in line with the knee. Now, if you can't, it's quite hard holding your leg there, so if you need to, you can just wrap your hands around your thigh and give it a little helping hand. But Hannah's young and strong, and she doesn't need to do that. What she's going to do with the other leg is just slide it away. She's going to do 6 heel slides. Now, this is quite difficult. It's quite difficult to keep the connection with the abs because your top leg just wants to bulge. So I'm going to ask her to pull those in. She's going to do 6. I think she's done 3. And then we're going to make sure that she's not overarching here and the ribs stay down. Fingers are relaxed. How many have we got left? 1 left. So that wasn't too bad. And then we're going to change the legs over. Now remember, you can always help the leg up and hold it if you need to. Do you want to hold that one? No? Just letting it go. Go. Feet are relaxed. No bulging here. Pull in. Thank you. Just 6. Because this is quite tough. You will feel a lot of pressure in your abdominals doing this one. This is really a good trunk stability exercise. If you've got socks on, they'll start to come off with this exercise. Have we got one left? Yeah. Okay, keeping that leg bent and carefully replace this one on the floor. Okay. Okay, so the next exercise we're going to do is called a knee drop. And what I'm going to ask Hannah to do is with the connection with the abs and a pelvis in neutral, so she's got a neutral spine, her shoulders are relaxed, her chin is slightly nodded. I'm going to ask her to place her finger on this hip here. So if you could do the same, place it on the opposite hip to the leg that you're going to work. And I'm going to ask her slowly to just let this knee roll away from the body. She's going to roll onto the side of her foot. This knee she's going to keep nice and still as if there's a hot drink on it. And when Hannah starts to feel this hip lift, she's going to pull that leg back. So if Hannah just shows you what will happen in a normal circumstance, you're going to let that go and this hip will come up. We don't want that. So we just take it as far as we get to that point where the hip lifts. Hannah's going to do 6 on that side, and I think that's number 3. Now, while you're doing this, it's a mind and body connection, and it might seem as if you're not getting anywhere at first, but after a bit you'll think, oh yeah, it'll suddenly click, won't it? Yeah. That's brilliant. Connect with your abs. Have we just got one more on that leg? Okay. I'm bringing it back. Okay, so Hannah is far worse on this side, and you may find the same. You might find one leg's brilliant and the other leg isn't so good. So she's going to work through this one slowly. She's going to keep that neutral connection with the abs all the time. If you feel it slip, that's natural at the first. I think that's far enough for Hannah. I'm just going to bring it back. So don't worry if this one wobbles at first. It will be something that you will be able to control eventually, especially when I do put a hot cup of water on there. That'll focus the mind. And I will, you know. It's really good. And Hannah's just got 2 more. So remember, keep the tummy in, shoulders are relaxed. Just 1 more. Oh, brilliant. Now, I hope you didn't find that too difficult, because I know this lady did. And just take a break for a second. Do whatever your body's asking you to do. It's to have a wriggle. Okay, the next exercise is called double knee folds. So what I'm going to ask Hannah to do is just bring this knee up and grab it round her thigh. She's still in neutral, and she's still got her tummy in. She's going to lift and lower the opposite knee. Now, as she lifts the knee, I'd like her to tuck her pelvis, so she's into imprint, and then take it down. Now, as that foot touches the floor, she comes back to a neutral. And again, tuck the pelvis into imprint. As she takes the leg down, back into neutral. Hannah's going to do 4 more. I'm just checking that she's now in imprint. And then as she takes it down, she's coming back beautifully to neutral. Now, if you want to progress this exercise, let go of this leg and bring it out a little bit lower. Now, that is quite tough. Yeah? So I'm going to ask Hannah to grab that again. I think she's just got 1 more. So when she comes up, this is where I'd like the ankle to be in line with the knee. And then take it back down. So we're going to change legs. So this is just practicing that pelvic rock. And it's also a stabilising exercise. So now she's in imprint. And now she should be in neutral as the foot touches the floor. And again, don't put too much pressure on this. You're just holding it. And if you don't want to hold it with your hand, you can always do it with a band. Now this leg, I don't want the angle to change on this leg. So it just goes from the hip up and down. And now she's in imprint. Have we 2 more? Yeah. All these exercises can be found on the free back care guide that you can download, but sometimes having something to watch and listen to makes it just a little bit easier. Okay, so Hannah's going to place the other leg down, and she's going to take herself back into that neutral spine. Okay, the next exercise we're going to do is an ab prep. Now this is going to build strength through your abdominals. Now we don't want a great big sit-up because that's 75% of your back. We're just going to do a small curl forward. What I'm going to ask Hannah to do is place one hand by, she can either have it by her ears or she can let her head rest in the palm of her hand, and the other hand is going to come on her belly. Now the hand on the belly is there to prevent it bulging. It's to remind her that it's not to bulge out, it's to pull in. We're going to add breathing in for this one because it does make it a little bit easier. What I'm going to ask Hannah to do is take a breath in, and as she breathes out, I'm going to ask her to nod her head and then start to peel her back off the mat. Not very far. That's it. And then she's going to take a breath in and breathe out as she rolls back. She's going to take a breath in, and as she breathes out, she's going to just roll up. It not very, very far. And then she's going to roll back down on an in-breath. So she's going to breathe out as she comes up and breathe in on the way back. But as long as you breathe, I'm happy. Okay? So Hannah can just breathe as she normally wants to. So if Hannah's confident that her belly's not bulging, she can place the other hand behind her head and just rest her hands. As long as she's not pulling on her neck and the action's coming from the top fibres of the rectus, that's fine. Shall we do 4 more? Can we do 4 more? Okay. Keeping her knees still. So what sometimes happens is that you press your knees together just to pull yourself up, and we don't want that. And I don't want the squeeze on the bottom neither. I want you to stay in neutral. So when she's in that bottom, she's got that slight curve in her back. Are we on the last one? We've got one more. Yeah. Okay. Now that can be quite a strain on the neck. So what I'm going to ask Hannah to do is just roll her head one side, and then she's going to gently roll it to the other. She's going to do that just a couple more times. And then bring it back to neutral. Okay, and the next exercise is we're going to use the upper body. So I'm going to ask Hannah just to take her hands up to the ceiling with the thumbs facing behind. Okay, we're going to do shoulder drops. We're just going to stretch out that upper back, which sometimes comes a little bit tense, especially if you've got problems with your lower back. So I'm just going to ask her to push her hands up to the ceiling and separate her shoulder blades. The shoulder blades are coming away from the spine, and then she's going to bring them back down, and the shoulder blades are going to shoot back down into her back pockets. And she's going to do that for me another 5 times. And down. This one should feel quite a nice stretch along the back. If you're quite tight in the back, this one's quite nice. She's nice and neutral, tummy's in, and the legs are in a nice position. Have we one more? One more, I'm told. Okay. And then Anna's just going to relax her arms. Okay, so the next one we're going to do, again, involves the arms, and it's called, it's an arm float. So I'm going to ask Hannah to raise her arms up towards the ceiling again, keeping it in neutral, no arching through the back. And what I'm going to ask her to do is take this arm, and she's going to place it on the opposite rib. Yeah. She's going to take this arm behind her nice and slow, and the reason she's got a hand here on the rib is to feel whether it moves, whether it actually comes up or flares. Because if it's moving, then the lower back's moving. We're getting an arch in the back. So Anna's just going to take it back as far as she can without any movement here. When she feels any movement, she's going to bring it back. She's going to just do 2 more, and then she'll change arms. Hannah's in neutral. She's just breathing normally. She's got a connection with her abs. And then she's going to change. Have you got one more to do on there? Thought she might have. She's very particular about accounting. Okay, and then she's going to change over. She's just going to do 4. Just placing the hands on the ribs. And you should be able to see here where Hannah's back arches. And it shouldn't arch if her ribs stay down. We're just doing 4. And there's just 1 left. And then I'm going to ask Hannah to lift both arms up. Now this will be a little bit more difficult. So she needs to keep the connection with the abs to bring her ribs down, and I'll keep her lower back. So she's going to take both of them back. And I think she's gone far enough there. See, she can't go half the distance with both arms that she could with one. So Hannah's probably a little bit tight in the back, in the shoulders, in the trapezius. We'll just do 1 more. Okay. And eventually, if Hannah kept going with this, she would be able to take her arms all the way back, but it all takes time. Okay, I'm going to ask Hannah to bring her arms down and just have a shake. Okay, so the next exercise we're going to do is quite technical, and it's quite difficult, so you take it at your own pace. We're going to combine the heel slides that we did earlier with the arms going back with the arm floats. So Hannah's going to start with her hands up towards the ceiling. She's going to keep a neutral spine. She's going to glide away this heel and take that arm behind her. She's going to bring them back, and then she's going to change. So if she wants to, she can release this arm, and then it comes up. Now, no movement through the middle, and we're keeping a nice connection with the trans abs. And she's just breathing normally, rather than holding her breath. We're minimising the rocking here. Remember, hips pointing right up to the ceiling. They stay nice and still. Just slow it down because you'll start to rock. And we don't want that. We need it to be as slow and